A warm welcome to today's talk, Monday the 18th of October. I've got some news from around the world today, Russia, Iceland. We'll be looking at a bit of orientation as well, but I want to start off with the official National Institutes of Health position on ivermectin. Now, of course, we can't give any disinformation on this channel. We have to go by references. So let's flick straight over to the reference we're going to be using here, which is directly from the National Institutes of Health website. And this is live. I'm actually on it as we speak. So this is characteristics of antiviral agents that are approved or under evaluation for the treatment of COVID-19. So remdesivir, we know, is being used. So that's remdesivir there, fair enough. Then here we have ivermectin. Now, it doesn't tell us which applies here. It doesn't tell us whether this is approved or under evaluation. I guess we have to assume that it's under evaluation. But it's there in bold black and white on the National Institutes of Health website. So really quite interesting that ivermectin is clearly there on the National Institutes of Health website. So I'm just reporting what the national guidelines are saying. So I think I'm pretty safe reporting this to you. It's interesting. So, of course, the FDA has got a slightly different take on it. This is the FDA position, and they've still got a picture of a horse, just in case we want people to think it's horse medicine. So the Food and Drug Administration, of course, it is used for horses, of course, but it's also been used for 3.7 billion human doses as well. So, and the FDA is, here's what you need to know about ivermectin. FDA has not authorised or approved ivermectin for use in preventing or treating COVID-19 in humans or animals. It's used in animals for other things and humans for other things, but not for COVID-19 here, according to the Food and Drug Administration. But then we go on and we look at the National Institutes of Health again. And here under the so this is National Institutes of Health here, COVID treatment guidelines. Again, official site of the United States government. Here's how you know. Click on it, check it out for yourself. This is the United States government site. And here we see that recommendations. There is insufficient evidence for COVID-19 treatment guidelines panel to recommend either for or against the use of ivermectin. So this is a much more neutral position in relation to COVID-19. Of course, results from an adequately powered, well-designed and well-conducted clinical trial are needed to provide more specific evidence based on guidance on the role of ivermectin to treat COVID-19, but we also know that no one is really motivated financially to do such a trial. But there we go. That is straight from the National Institutes of Health website. So pretty hard to argue with that, really. Let's look at what it's saying. Adult dosing regime. It actually gives the dosing regime here. So the most common used dose in clinical trials of ivermectin is 0.2 to 0.6 milligrams per kilogram of the patient's body weight per oral, given as a single dose or as a once daily dose for up to 5 days. So they report that straight from the NIH. That's what they're saying. Adverse events. Well, generally it's well tolerated. But in some cases, like any drug, it can cause side effects, so dizziness, itching, pruritis itching, GI effects, nausea and diarrhea. And then they go on to report that there's been some cases of neurological reports on side effects. And this is the National Institutes of Health again. Neurology adverse events have been reported when ivermectin has been used to treat parasitic disease, but it's not clear whether these adverse events were caused by ivermectin itself or by the underlying condition. Now, what they believe might be happening here is that ivermectin is such an effective antiparasitic drug, it will kill huge numbers of parasites all at the same time. And those parasites, wherever they are in the gut or in the eye or wherever they are, will start to decompose, basically, because they're dead. And the body will start to break them down, of course. But basically what that means is that once the parasite's dead, all the gooey bits inside the parasite can get out and essentially poison the person's circulation, giving rise to adverse effects because it's treating the parasite. We have the same with antibiotics. Sometimes when we start antibiotic treatments, patients actually get worse. They feel terrible for a period of time because the antibiotics are so effective, they actually break down all of the bacterial cells. And that means the contents, the so-called endotoxins inside bacteria, can get out and can poison the system for a period of time. So they're saying they don't know which it is. And this is the National Institutes of Health. Comments and links to clinical trials. They say generally ivermectin is given on an empty stomach with water. However, administering ivermectin with food increases its bioavailability, so more gets to the tissues if you give it with food. And then that's the hyperlink. I've left that as a hyperlink in your description, so click on it, review it for yourself. That takes you straight through to this site here, your United States National Library of Clinical Medicine, clinicaltrials.gov, and it reports on 81 studies either started or completed on there. So I just thought that was rather curious, really. Now, this was actually been up since July, and I'd missed this. It was Anne in Ireland that alerted me to this. So thanks for that, Anne. Obviously browsing very, very thoroughly. But there you go. That is straight from the National Institutes of Health site live. And that was the FDA, and that was the NIH recommendations. So there we go. Interesting, I thought. Now, just a bit of orientation before we move on now. What is going on in this pandemic? Well, let's look at this here. So these are new daily confirmed cases. New Zealand, a few, unfortunately. Then Canada. Then Australia levelling off there by the looks of it. Canada still going down gradually, I would say, from that. Netherlands, quite a sharp increase in cases there, quite a sharp uptick in the Netherlands. But the United States line continues to go down. The Ireland line is going up roughly at the same rate as the Netherlands, but a higher level overall in Ireland, unfortunately. The United States going down really quite dramatically. In the United Kingdom, dear me, wait for it. Very high numbers in the United Kingdom. So what is the difference between the United States and the United Kingdom? Well, the answer is we don't know what's causing this difference. There could be more community herd immunity in the United States as more people have received the natural infection, potentially. But it's impossible to ignore that one of the big differences, and I don't know this, we don't know this, but one of the big differences between the United States and the United Kingdom is the Oxford AstraZeneca vaccine, which has been used extensively in the United Kingdom, but not used at all in favour of the Pfizer, Moderna, and to some extent the Janssen Johnson & Johnson vaccine in the States. So two big variables there between the States and the United Kingdom, and delighted to see the cases are going down so sharply in the States. Look at that. But the United Kingdom, we were just, in terms of cases, absolutely scooting up. And I don't know, I don't think anyone really knows, but the United States didn't use Oxford AstraZeneca. The United Kingdom did use Oxford AstraZeneca. More to come on that, I suspect. Number of patients in hospital per million. Now, this is what's particularly important. Now, here we see the Netherlands coping well. Canada levelling off. We do know there's some strain already in Ireland, because in Ireland there are limited capacity in some areas. United Kingdom, slight increase in hospitalisations there, and given the new increase in cases in the UK, I'm afraid that could go up somewhat as we go through October, 18th of October now. United States, still more people in hospital, so there's still a significant strain on the hospital system in parts of the United States at least, but going down really quite nicely. But still, has to be remembered, fairly high levels of hospitalisation still in the United States. Share of the population fully vaccinated. Well, look at this. This is quite interesting. Basically, New Zealand has now overtaken the United States, and Australia will in the next couple of days. So excellent increase in Australia and New Zealand there. Then the United Kingdom, Netherlands, Canada and Ireland at the top there in terms of vaccinations. So looking at that line there in the United States, it's going up gradually, but very, very gradually. United Kingdom, well, you'd have to say that line's pretty flat, really. So we're not really improving in the United Kingdom much there. Moving on to new daily confirmed COVID deaths per million. Now, I've included Russia here. Now, Russia at the moment are getting about just under 1,000 deaths per day in Russia at the moment on the official reporting figures, and that's one of the things I want to look at in a minute. That's why I put this on here, and the news isn't particularly good, I'm afraid. But if we look at deaths, let's look at that now. New Zealand, thankfully, essentially zero at the moment, I believe. Netherlands, Australia, Ireland, Canada, United Kingdom, again, probably looking at a slight increase in deaths as we go into the end of October, beginning of November, because of the increase in cases. United States, daily deaths are remaining stubbornly high. They haven't gone down as much as the hospitalizations have in the States, unfortunately. But Russia, very high deaths at the moment. And it would seem appropriate just to remember Colin Powell, who sadly died today from complications of COVID. I believe General Powell had multiple myeloma, which would have caused immunosuppression. But former Secretary of State, of course, in the United States, and we send our condolences to his family and friends. But just looking at the picture for cumulative deaths now, Australia, New Zealand, thankfully relatively low, then Canada, then Ireland, Netherlands, and we see that Russia, the cumulative deaths here, although they're going up quite sharply now, we see that they're still quite a lot lower than the United States and the United Kingdom in terms of per capita deaths. So overall deaths in Russia relatively low compared to the United States and the United Kingdom, according to this data. But is this accurate? Of course, is the question. Now here's the current picture from Russia at the moment from Johns Hopkins site. That's the vaccine figures. So here we see that the deaths. So basically 8 million confirmed cases in Russia. 219,342 deaths. Low vaccination status, very low public trust in the vaccine. Under 33% of the population fully vaccinated in Russia. And we've talked about the reasons for this many times, largely due to the fact that the medicines, the vaccines were introduced before the clinical trials were completed. So let's look at Russia now and see what the real situation probably is in Russia. So that's the official deaths there, as we've said, just live from the site, 219,000. And these are all the links here. Click away to your heart's content. Now, independent demographer Alexey Raksha, using data from Rossat, which is Russia's equivalent of the National Statistical Agency. So these are official statistics from all the different regions in Russia that he's been able to put together. So it's from this official federal state statistical place. I've actually got the site. No, I haven't got the site there. That's actually the site we've just looked at, the Johns Hopkins ones. Never mind. But that's the site there. Do check on it for yourself. He calculates the excess mortality to be 750,000. Quite a lot higher, it has to be said, than it's more than 3 times higher, 3.5 times higher, isn't it? So that's the official death toll there. Calculated excess mortality, which is probably the most accurate. You might remember that we looked at the excess mortality in the United Kingdom, was it yesterday or the day before? And we found out that the overall excess mortality in the period of the pandemic is quite a lot less than those that have been dying after 28 days of an official diagnosis. Quite a lot less than those who have got COVID-19, SARS coronavirus 2 mentioned on the death certificate. So the excess deaths in the UK probably below 100,000 because many of those people would have gone on to die shortly anyways. The Office for National Statistics are calling this mortality displacement. But Russia, it appears to be the absolute converse. So excess mortality, the most accurate indicator, we believe, 750,000, according to this data put together from all the different regions. Now, the Moscow Times, again, check on the link for yourself. This is the English language version, so it's intelligible. Excess mortality, they estimate to be 660,000. Again, well, it is. It's pretty well exactly 3 times the official death figure, isn't it? From the statistics from the put together by the Moscow Times. So no question that the deaths in Russia are grossly underreported. That is the Moscow Times link. It's a hyperlink in the text, so you can click on that. Quite interesting. The Moscow Times are saying officials manipulated statistics and underplayed the crisis, as has happened in China, as has happened in Turkey. They give us further examples. Article there in the Washington Post about that as well. Alexander Q, this guy here, Alexey Q. Parinov, independent analyst and biologist. He says this, direct quote, "The data for Russia is absolutely unreliable." Now, he did work for St. Petersburg campus of the Higher Education School of Economics, but was sacked apparently in September 2020. We don't know why. But he has said that the data is absolutely unreliable. So the definite mortality is 3 or 3.5 times higher than officially. Handling of the pandemic largely left to the regions, he identifies. Regional officers concealed problems for fear of losing their posts. Does that remind you of anywhere else? That's why this pandemic was hushed up in the first place in China, wasn't it? The regional authorities in Wuhan didn't want to upset their masters in Beijing. Therefore, critical, even analytical experts are sidelined by these regional people. But if you do go back to the original statistics, the traditional ways of reporting these problems in Russia do actually reveal the truth, and that legwork, that donkey work, has been done. Now, the last thing I want to look at today is this. Iceland restricts use of Moderna vaccine, one of the mRNA vaccines, of course. Again, this is the official site. You can access it yourself. It is in Icelandic, but there are English translations. And various news reports. Now, chief epidemiologist in Iceland has said Moderna only used for booster shots in the over 60s. So booster shots, the booster program is being rolled out now in Iceland, but unless you're over 60, you're not going to get a Moderna. And he says unpublished data from Nordic countries indicate that the risk of cardiac inflammation after vaccine against COVID-19 is much higher amongst 18 to 39-year-olds. 18 to 39-year-olds. If the Moderna vaccine is used rather than the Pfizer vaccine. So, interesting. And to be quite honest, a little bit alarming, to be quite honest. So this is unpublished data, but this is on the official epidemiologist site in Iceland, saying that in the 18 to 39-year-old age group, it looks like it's safer to have a Pfizer rather than Moderna booster. Unpublished data, but with no reason to assume that the chief epidemiologist for Iceland is lying. Again, check on the links for yourself, make sure I'm interpreting the data correctly, but I believe I am. Now, we wait for this data to be published, of course. When it is published, it's going to have major impact, but we believe this data is collected in all the Nordic countries. So it's a good data set, and it's going to be interesting to see what it says, but he's taking action on that data now at this early stage. Cardiac inflammation after vaccination is much less common amongst older demographics, so the over 60s is not such a big deal. What about the younger demographic, the 12 to 17-year-olds? So what he's saying is he knows it's the 18 to 39-year-olds. Moderna is more likely to cause heart inflammation than Pfizer. But this group, he says, there's a lack of European data. So we don't know. But they are not giving Moderna to this age group either, of course, because they are under 60. under 60s who've received a single shot of Moderna to complete their vaccination with Pfizer. Okay, that's got pretty big implications for the United States if this data transpires to be indicative of how practice should change. Men 18 to 39 are not recommended to accept the Moderna COVID-19 vaccine. Icelandic data, vast majority of that's the advice from Iceland, and the vast majority of vaccine side effects emerge shortly after vaccination, as we know. So, looking like from this data, men, especially 18 to 39, according to the unpublished Nordic data, would be safer to have the Pfizer than the Moderna. I did have a quick look on the JVCI and the FDA websites on this, and I couldn't find any mention of this at all. Let's hope that they are examining this now, and we'll be following that one with interest, because pretty serious implications there. Now, this is Jessica's cat Cleopatra. And I seem quite popular with cats. Strange, isn't it? Quite a few cats seem to be fascinated. I'll leave you to make your own mind up about that, and thank you for watching today's video.